Good afternoon. Thank you for tuning in today. My name is Jeff. I'm right here. With me today is Brightsquid CEO Rohit Joshi, and from Northland OMS we have Terry Tarasov with us. Rohit and Terry, how are you?
Doing good, thanks. How are you?
Great, good.
Thanks
for joining us today. Before we launch into the presentation, we want to keep this conversational. We try to reserve as much time as we can for the conversation at the end. There is a question panel where you can answer questions as we go through, as they pop up, and we will get to those at the end. We've collected a few in advance, but if anything pops up, please let us know. So, Northland has been using Brightsquid since 2016, believe it or not, Terry. And on a monthly basis, is sending about 650 to 750 messages if you go through. So most recently, 674. You've invited over 2,000 patients to the system, as well as over 200 other clinics. And we were just chatting quickly before this. What's interesting about Northland is the fact that you use secure mail in both ways, for both professionals and with patients. Terry, can you tell us a little bit about how that fits into the practice and why you're using secure mail with both professionals and patients?
Okay, definitely our patients' privacy is our #1 concern. So obviously that's why we started with Brightsquid. We encourage all of our patients to use it, and we will only correspond with them that way. So if a patient says, hey, can you just send it to me regular mail, don't want to, do the whole Brightsquid thing, we won't, just for security purposes. It's their private information. Once we explain that, everyone is on board with it. You know what I mean? No one wants their information out there. So we send all of our new patients the paperwork that we want them to fill out before their appointment. Again, with COVID going on, we're trying to limit the amount of people here, so we want them doing everything at home. And then for professionals, anytime after a surgery, any x-rays that we send to them, any correspondence at all, again, only goes via Brightsquid to any professional that requests it.
Great. And that implementation, so when you started using secure mail with the patient, how did that change things in the clinic? How have things improved? What's different now that you're using secure mail instead of mailing patients and things like that?
I say so. It's saved us a lot of time, because a lot of people are they'll create their user name and password, they'll do the forms, and then they send them back to us too. So we're getting paperwork before they walk in the door, so we're having a lot of information that we can already import. And then even if they have questions or insurance or financial, they're just emailing us via Brightsquid now.
Oh, great. Okay. And I know when you implemented forms and everything and going through that stuff, you were part of the initial templates beta testing, and now that templates is rolled out across the system, how much did that change things for you once you got your hands on those?
It was huge, because you can send the same email how many times a day, typing it out or whatever, but now I just find the template, boom, it's in there. The only thing I'm doing is picking the address and then any attachments. It saved a lot of time for all of us.
That's great. Terry, within your clinic, how many of the staff are using it? Is it everybody, or have you kind of designated a group of people that are really kind of interacting with the patients more often?
It'd be more the front end girls, like our administrative team. Our clinical team doesn't use it very often unless someone maybe said during that appointment, could you send me a copy of this? Or, if they wanted to reach out to them that way. A lot of our patients, if they're over 50, do require some additional testing before some of our surgeries. So we send the requisitions that way to the patients, and so the nurses or dental administrators send it that way to them as well.
That's very interesting. And so when you get the information back from your patients, really curious, do you take that information and then put it into your practice management system, or do you leave it in secure mail?
No, we usually, the forms will print off right away and get everything imported into their chart.
Okay, got it. So you keep all of that information still in the chart, rather than having two different sources of information. Makes tons of sense. And we see that as the best practice, actually.
Yeah, we are in the process of changing our forms to be online. So hopefully that will save one step for us.
Right.
But yeah, all the information is in the patient's chart, all in one area, so you're not going all over the place. The only time sometimes we might not import something is some of the larger scans and files that we get are large, so maybe it can't be imported into their chart, and then it's kept in Brightsquid.
Okay, got it. Right. So you're receiving diagnostic imaging
Correct.
through Brightsquid, and then you're just keeping it there. Got it.
Yeah, and again, we tell all of our offices, you have to send it Brightsquid. We don't accept it any other way.
Boy, I feel like I want a very loud speaker, and I'm going to drop it off at your office if you could say that every day.
Yeah, we get frustrated when we can't, or if they're not on Brightsquid, it's not a good thing.
That's awesome.
Yeah, well, and I think, you know, when you and I talked about this initially, the words that you described faxing were typical, but also very strong and much stronger than most people, I think, a lot. And, you know, I think one of the things that you said, I mean, and it's true, you know, we rely on fax, but a lot of times people don't consider how much extra work it is. I think one of the things you said in your clinic, you guys would rather drive over a form or some patient records instead of faxing it because it's such a waste of time. So, and that kind of brings us on.
Like, I'm scared. I don't want to send a fax because, you know, did someone write a wrong number down? Like, I don't want to send someone's information to the wrong place. So to me, like everyone, we have like a nervous breakdown if we have to use the fax machine or if we have to send it some other way. Like, it's just, we don't want to do that.
I can tell you there's so many breaches that you would know as well. You know, Terry, that there's so many breaches that occur because of exactly what you're talking about, where information ends up where, you know, it's sort of a blind send, you know, when you send it through the fax. So very interesting.
Yeah, I'm looking forward to you guys to launch the fax Brightsquid.
Well, there's another story in that, so that'll be interesting.
We'll get you set up on the test for that. But and you know, I think what's interesting about, you know, talking about fax, your point is exactly right. You know, people rely on fax and assume it's secure because we've accepted that. But the realities of fax are that there is a series of processes that you need to implement to make fax secure because it's not secure on its own. And according to the OIPC in Alberta, you actually have to call somebody before you send them a fax and find out if this is still their fax number. Are you ready to stand by your machine and receive a fax? Nobody's doing that, right? And that's why people are shifting to secure because the process itself is already secure and compliant. You don't have to worry about it.
Plus, fax is very unreliable.
Yeah.
You know, do they have paper in their printer? Did someone actually grab the fax? You know what I mean? It's not like emails where it's just like right there.
Yeah, 20 to 30% of faxes don't go through the first time. Right? I think that's the stat now. So yeah, that's a problem. Now, just looking back, so we're looking at professionals right now, and I know, you know, we're replacing fax, we're making those communications more quick. I know you've implemented a template for your surgery notes to follow up. So you just attach the document and say, hey, we saw your patient. Here's what happened. Now, post surgery with your patients too, I know you're sending instructions along. Here's how to care for, you know, where we pulled out your tooth, that sort of thing. How has that changed things for the clinic from an operations standpoint, or making things easier for the front desk?
You sorry, do you mean to get the patient like the information that they need, like the instructions and that?
Yeah, after they've left the clinic,
Okay. Yeah, I mean, they get so much information. They get it on the consultation day, they get it on the surgery day, but a lot of time they'll come not with the person that's going to bring them to the consultation. And, you know, once you get home, paperwork just disappears. So again, it lets us send that information to them so they can print it off, give it to their parent or grandma, grandpa, whoever. So then they can also have that information to them. So it's really great.
Right. And then have you noticed a difference in terms of treatment adherence? So people have that information with them all the time, they can reference it. How do I do this wound care or something?
Yeah, for sure. Yeah, you know, they go back to that, and then it's a lot of information for people to come to these appointments. You know, it can be very emotional as well, and it's a lot to take in. So having the ability to email them back those instructions where, you know, they're at home now, even though they've heard it a million times, they can't remember what the answer was. So then they can make reference back to that when we send it over to them.
Excellent.
Yeah, really good. Well, I mean, that brings us to our formal presentation, as formal as we are here. And now we have a couple questions lined up. You know, I will say to our audience, if there's any questions that come up through this, you know, again, please answer them in the question panel. So Terry, can you talk a little bit about how you manage templates? So I think you recognize that you had standard messages you send. Most of us in our day-to-day don't send the same emails repetitively like a clinic would.
Yeah.
How do you manage them? How do you create them? Who does that? Is that assigned? How do you know when to create a template for something?
So with us, there's myself and another colleague that we send majority of the emails, I would say. And we do a lot of the setting up and creating like verbiage and that sort of thing. So her and I kind of knew which ones we were sending out on a daily basis. So I just started creating the ones that I was using. She started creating the ones she was using, and then we let the other staff know. We had one clinical staff member that she didn't know about it. So every time she was typing this out, and when we told her, she was like, no way, like, why didn't you tell me this so long ago? So setting up the templates is super easy. I see you guys have even alphabeticalized it now.
Yeah.
We don't do that because where I had it, it's not in the same spot anymore. So that was great. Really easy to set up the templates. Wasn't hard at all. We have two of us doing it. Just again, we want to be very strict on the verbiage. We don't want people just kind of making up their own verbiage. We kind of have a set dialogue that we like to use at a professional level. So I'd say there's just more two of us that are doing it, but it's very easy to do.
So a good boost to sort of the professionalism, but also that control of the message, so you can be sure that it's clear.
Yeah, and consistent.
Yeah, right. And in that sense, so what percentage would you say of your messages right now are being sent as templates?
99.9.
Wow.
If I have to type it out, I'm not a happy camper.
Right. And you mentioned earlier, like a time savings. How, like, what do you say that is now that you're not typing those things? How much time are you getting back in your day?
Oh, I mean, you think it's minutes per person you talk to and how many people you talk to in a day.
Yeah.
A lot. Like I wouldn't even know what to say, but I mean, you know, 2 or 3 minutes at least per patient that you talk to, times by how many phone conversations you have, a lot of time in the day.
And you're sending somewhere between 30 and 40 messages a day. So yeah,
at
that
least,
adds up really quick. Yeah, interesting. And so in that sense too, because you mentioned patients are sending secure mail messages to you for ways you didn't expect. Is the volume of messages from patients manageable?
Very much so.
Okay.
Yeah,
good.
Very much so.
Good. Yeah. And then what is the?
Is it a substitute? Sorry, Terry. Jeff. Is it a substitute? Do you think for the phone? You know, are people using the secure messaging rather than giving you a call? Is that sort of how you're seeing it, or is it used differently, Terry?
It can be used that way. Not trying to be age demographic, but the younger kids, you know, they don't want to talk to anyone. So if they can email you, they're going to email you or text you. So I feel probably they are, or, you know, they're in school. They can't talk to you. They're at work. They're in a meeting. I don't have time to talk to you, but I can definitely send you a quick email. So I do see that. The older people, I don't think use it as much as that.
Right.
They'll definitely take the time to set up the Brightsquid in the account, because I feel, you know, they're always worried about being hacked or, you know, their private information. So the elderly people are definitely taking the time to set it up, but I don't think they correspond too much with it once they get the initial stuff.
Got it.
Great. So we're very close to the end here. I want to be respectful of everybody's time. So final question relates to the professional users. So you said you don't accept fax. You accept secure mail messages from the other clinics that you collaborate with, or they refer to you, or you refer to. How is reception of that? Like, do you feel like you've lost relationships because of it, or or are the other clinics fairly accepting of that policy?
No, I don't think we've lost business at all. I definitely think most clinics have been receptive to it. There are some clinics, we were sending and, they just weren't accepting the invite. So we actually went over there to help them set it up. And then they were shocked at how many, I think when they contacted you guys, they could showed them how many emails like were pending for them. And then they realized we should probably get this set up. I think the offices that don't set up, my guess would be it's just they don't understand it, or they don't have someone maybe consistent in their office that would check it.
Right. Right. So it's a new channel that they have to get used to checking and using, right? Yeah.
Yeah. And some people just, they don't want one more thing to do. Again, I don't find that very often. Most people are receptive to it.
Cool.
And most people know about it or are already on it.
Yeah. Awesome. Yep. Yeah. I mean, there's what did we look at it today? There's 4,500 healthcare organizations in Alberta that have a secure mail account. So it's quite a lot.
You guys have done, you're bigger now than when you initially started. A lot more people are aware of it, and they're like, oh, I know this because of my doctor or my therapist, so a lot more people are a lot more common with it. So they're not as scared. Once we say it, they're like, oh, I already got an account set up.
Oh, that's great.
That's great. Awesome. Well, that brings us to our time. And Terry, thank you so much for all your input today. Really appreciate it. And I know it's insightful and helpful. I mean, part of the challenge for people, as you said, coming onto this is figuring out how to use it and how to apply. So all your work that you've done and implementing this and getting it sort of standardized through your practice is super helpful to share that. Thank you so much.
You're welcome.
Thanks for your time too.
Yeah, it was great. Thanks, Terry. And really appreciate your time.
No problem. Have a great day.
Bye.
Thanks, you too. Bye, everyone.